Hi, this is Michelle, and today I'm going to show you some simple exercises you could do for a stiff wrist. So say you had a wrist fracture or wrist injury and you were in a cast, and the doctor said you could come out of it and start moving, but you didn't really get any further exercises or instructions on things to do. So in this video, I'll show you some simple exercises you can do to help with a stiff wrist after having a wrist fracture or distal radius fracture or perhaps another wrist injury. You don't want to do these if you're still having, if you still have an active fracture in your wrist and the doctor hasn't cleared you for motion. So first off, I always like to start exercises with the fingers or the wrist with a hot pack. So I have a hot pack that I have made here, and it just has rice inside of it, and I sewed it, and you can put this in the microwave for about 60 to 90 seconds, and it stays nice and warm for about 10 to 15 minutes. If anybody's interested in how I made this, maybe I can make a video on how to make a DIY hot pack. So anyway, 10 to 15 minutes, simply wrap it around your fingers and your wrist before you get started, and that just helps kind of increase the circulation in the wrist, helps with increasing blood flow, kind of warms you up before you start your motion, makes it less painful too. So once you've been out of the hot pack once you get done with the hot pack, then you want to start on doing just active finger exercises. So I would just start with just doing some simple pumping exercises with the fingers, especially if your fingers are stiff after having a wrist injury. So about 10 times. And then what you want to do is do a few thumb exercises too. So I would bring the thumb across the palm, and you'd want to do that about 10 times as well. And then I would go to each finger, working on just warming up those tendons. Those tendons cross through the wrist, so these are important to do so you get some good glide of your tendons through that wrist. Good. Now what you want to do is start on some wrist motion. So the most important exercises are moving that wrist back and forth. So you'd want to do about 10 of these, just moving the wrist down and back. And you'd want to do that again about 10 times as well. Now, if it hurts to do this full motion, I would take this in two parts. So you could move just wrist back. This is wrist extension. So you could just go from neutral to extension and do that one 10 times. And then you could do wrist flexion from neutral and do that one 10 times. And that might just help kind of ease you into doing a full motion. Now the next one you want to do is a side-to-side motion. This is radial deviation and ulnar deviation. So this is moving that wrist in a side-to-side motion. This motion is very important when you're picking up objects, when you're, say, pouring coffee, reaching for the milk in the refrigerator. When you reach, you kind of have to deviate and ulnarly deviate, and then you have to radially deviate to pick that object up. So it's very important to keep this motion. Now my forearm is turned towards you. You can do these motions any way that's comfortable for you. You want these to be pain-free as well. So you should be doing about 10 of those as well. Now what you also want to do is work on forearm rotation. So usually when you break your wrist, it's common to get stiff with forearm rotation. So I'm going to kind of prop myself up here a little bit so you can see my forearm. And what you want to do is work on rotating the hand up and down. And it's important to keep the elbow and to your side when you're doing this one. Or else, you know, sometimes people want to kind of rotate and kind of do this motion. And then you're compensating with your shoulder and not getting a good true rotation with the forearm. So this is called supination, and this is called pronation. And again, this one you can also take in stages. If you want to just start here and you're resting in the very beginning, if it hurts to do this full rotation, what you can do is start this is your starting point in a neutral position, and then you can just turn up and up to neutral, up and up. And once you've done 10 of those, then you can do palm down to neutral to palm down. And that's usually a little more comfortable also than doing this full rotation all the way over, especially if you have some pain on this side of your wrist, which is very common after you've broken your wrist. So 10 of those. Now, you also do want to make sure that you're moving the elbow. So if your elbow was free and was in a short cast, you should have full mobility of the elbow. If for some reason you were a both bone fracture and you had to have your elbow in it, hopefully you were able to be removed. You were able to take that off and move your elbow. But if not, you definitely want to do some elbow exercises and do some shoulder exercises. And I can post some more videos specifically to elbow and shoulder as well. I hope you enjoyed the video, and I hope this helps. Let me know if you have any comments. Thanks.